Forget high blood pressure. This silent pulse. Reading is the real stroke warning. Are you just checking your blood pressure and thinking you're safe from stroke? Think again. Millions are walking around with a ticking time bomb in their chests, a silent warning sign that traditional blood pressure cuffs often miss entirely. This isn't just about high numbers, it's about a hidden pulse anomaly that could be the real predictor of a devastating stroke, lurking unnoticed until it's too late. What if I told you there's a crucial pulse reading that, if ignored, could lead to irreversible brain damage? You need to understand this, because your life, or the life of someone you love, could depend on it. This information is going to change how you monitor your health forever, giving you the power to detect a critical risk factor that 99% of people completely overlook. Don't let yourself be caught off guard by this invisible threat. You won't want to miss the final habit, or 99% will miss the last tip, and will be stuck with high blood pressure, undiagnosed AFib, and stroke risk for life. The conventional wisdom about stroke prevention often centers on managing high blood pressure. We're constantly told to watch our systolic and diastolic numbers, and for good reason. They are vital indicators. But relying solely on these two figures is like only watching the speedometer when you should also be checking your fuel gauge. There's a subtle, yet incredibly powerful metric emanating from your heart that most people, even many healthcare professionals, aren't prioritizing. It's a silent pulse reading, and it's sounding the alarm for stroke risk in ways your standard blood pressure simply cannot. Imagine a situation where your heart isn't beating quite right, but you feel absolutely fine. No chest pain, no dizziness, no shortness of breath. This is the insidious reality of what we're about to uncover. A hidden irregularity that significantly elevates your stroke risk without a single obvious symptom. This silent culprit can allow blood clots to form, which can then travel to your brain, causing a stroke that seemingly comes out of nowhere. It's time to pull back the curtain on this hidden danger and equip you with the knowledge to protect yourself and your loved ones. Another critical, yet frequently ignored pulse measurement is lurking within your standard blood pressure reading, waiting to be interpreted. This isn't about if your blood pressure is high, but how high the difference is between the top and bottom numbers. A wide gap here signals arterial stiffness, a condition that can independently predict stroke risk, especially as you age. While traditional BP checks give you two numbers, the relationship between those numbers can be a far more potent warning, a silent indicator of your vascular health that demands your attention. Understanding both these silent pulse warnings is absolutely crucial for comprehensive stroke prevention. Decoding atrial fibrillation, AFib, the irregular rhythm that steals brain power. Let's dive into the first critical silent pulse reading, atrial fibrillation, commonly known as AFib. This is the most common type of heart arrhythmia, or irregular heartbeat. While many people associate heart issues with chest pain or a racing heart, AFib often operates in stealth mode, quietly increasing your stroke risk without you even realizing it. It's not just an inconvenience, it's a serious medical condition that demands attention. So, what exactly is AFib? Normally, your heart's upper chambers, the atria, beat in a regular, coordinated rhythm, pumping blood efficiently to the lower chambers. With AFib, these upper chambers quiver chaotically and rapidly instead of beating effectively. This irregular, often rapid heart rate can cause blood to pool in your heart, especially in a small pouch called the left atrial appendage. This stagnant blood then becomes a breeding ground for blood clots. Here's where the danger escalates. If one of these blood clots breaks free and travels through your bloodstream to your brain, it can block a blood vessel, causing an ischemic stroke. These types of strokes, caused by blood clots originating from the heart due to AFib, are often more severe and can lead to more significant brain damage and worse long-term effects than other types of strokes. This makes early detection and management of AFib incredibly important. The truly terrifying aspect of AFib is its silent nature. A significant portion of people, between 15% and 30%, experience what's called asymptomatic or silent AFib, meaning they have no noticeable symptoms at all. They don't feel heart palpitations, dizziness, or shortness of breath. This makes it incredibly easy for the condition to go undiagnosed for years, silently increasing their stroke risk with every irregular beat. It's why relying solely on how you feel is a dangerous gamble. The statistics are stark. People with AFib are a shocking 3 to 5 times more likely to suffer a stroke than those without the condition. In fact, AFib is responsible for an estimated 15% to 20% of all ischemic strokes. This isn't a minor increase in risk, it's a massive escalation that highlights why this silent pulse reading is arguably the real stroke warning you need to be aware of, even more so than just your overall blood pressure numbers. Don't let ignorance leave you vulnerable to this powerful threat. Your home detection kit. How to spot AFib before it's too late. The good news is that you don't need to wait for a doctor's appointment to start checking for this silent killer. You can begin monitoring for AFib at home with simple, accessible methods. Empowering yourself with this knowledge and these tools could literally save your life or prevent a debilitating stroke. This proactive approach is a game changer in heart health and stroke prevention. The simplest and most fundamental way to check for an irregular heartbeat suggestive of AFib is by manually checking your pulse. It's a quick, free, and effective method that anyone can learn. Place your index and middle fingers on your radial artery, on the thumb side of your wrist, just below your palm, or your carotid artery, on the side of your neck next to your windpipe. Count the number of beats for 30 seconds and multiply by 2 to get your heart rate per minute. More importantly, pay close attention to the rhythm. Does it feel steady and regular, like a metronome? Or do you notice skipped beats, extra beats, or a chaotic, irregular pattern? If the rhythm feels erratic, too fast, or too slow, generally outside the 6,100 beats per minute resting range, it could be a sign of AFib and warrants a conversation with your doctor. Make this a regular habit, perhaps once a day, to establish your baseline and quickly spot any changes. Beyond manual checks, modern technology offers powerful tools for at-home AFib detection. Smartwatches with built-in ECG, electrocardiogram capabilities, like many Apple Watch, Fitbit, or Garmin models, can track your heart rate and rhythm throughout the day. Some can even alert you to irregular rhythms that might suggest AFib. While these devices are not a substitute for medical diagnosis, they can provide valuable real-time data and flag potential issues that you can then discuss with your healthcare provider. Always remember to share any unusual readings or alerts with your doctor. For more clinical-grade at-home monitoring, handheld EKG devices like KardiaMobile are excellent options. These small, portable devices allow you to take a 30-second medical-grade EKG reading by simply placing your fingers on the sensors. The results are displayed on your smartphone and can be easily shared with your doctor, making it much easier to capture intermittent AFib episodes that might be missed during a brief in-clinic test. These tools are particularly useful if you experience occasional symptoms or have risk factors for AFib. The importance of regular, consistent monitoring cannot be overstated. Since AFib can be silent and sporadic, checking your pulse daily, whether manually or with a device, significantly increases your chances of early detection. Early detection means earlier intervention, which is crucial for reducing your stroke risk. If you notice any irregularities, even if you feel fine, document them and speak to your doctor immediately. They can perform further tests, such as a Holter monitor, a wearable device that records heart rhythm for an extended period, or a full EKG to confirm a diagnosis and develop an appropriate treatment plan. Being vigilant about your heart's rhythm is a powerful step towards stroke prevention. The unseen force. Understanding your pulse pressure. Now, let's turn our attention to the second silent pulse reading that can be a real stroke warning. Pulse pressure. This often overlooked metric provides crucial insight into the health and stiffness of your arteries, and it's something you can easily calculate yourself from any standard blood pressure reading. Understanding your pulse pressure offers a deeper layer of cardiovascular assessment beyond just your systolic and diastolic numbers alone. Pulse pressure is simply the difference between your systolic blood pressure, the top number, which measures pressure when your heart beats, and your diastolic blood pressure, the bottom number, which measures pressure between beats. For example, if your blood pressure is 120/80 mm/Hg, your pulse pressure is 120-80, which equals 40 mm/Hg. This number represents the force your heart generates each time it contracts and pushes blood through your arteries. So, what's considered a healthy pulse pressure? Generally, a normal pulse pressure range falls between 40 and 60 mm/Hg. Some sources also suggest a range of 30 to 50 mm/Hg. A pulse pressure within this range typically indicates healthy, flexible arteries. However, once this number starts to creep higher, it signals a potential problem with your cardiovascular system that significantly elevates your stroke risk. This is a silent indicator because most people focus only on the systolic and diastolic values, missing this crucial calculation. Why is a high pulse pressure dangerous? A pulse pressure greater than 40 mm/Hg is generally considered unhealthy, and consistently 50 mm/Hg or more increases the risk of cardiovascular disease, including stroke. A pulse pressure greater than 60 mm/Hg is an even stronger risk factor for heart disease, especially in older adults. The primary reason for this heightened risk is arterial stiffness. As your arteries lose their elasticity due to aging, high blood pressure, and plaque buildup, they become stiffer. Stiff arteries don't absorb the force of each heartbeat as efficiently, leading to a wider pulse pressure and putting more strain on your heart and brain. Research has shown that every 10 mm increase in your pulse pressure can raise your risk of coronary artery disease by 23%. More importantly for our discussion, pulse pressure can be an independent risk factor for stroke, even in middle-aged individuals with otherwise normal systolic blood pressure. This means you could have normal blood pressure readings, but a wide pulse pressure could still indicate a significantly elevated stroke risk that's being overlooked. Consider this alarming statistic. People who simultaneously have a resting diastolic pressure of less than 60 mm/Hg and a pulse pressure greater than 60 mm/Hg have a 5.85 times greater risk of stroke compared to those with healthy readings. This combination points to extremely stiff arteries and insufficient blood flow to the brain, a recipe for disaster. This is why knowing and tracking your pulse pressure is just as vital, if not more so, than just your basic blood pressure numbers. It's a silent, powerful warning that tells you how much wear and tear your arteries are actually experiencing. Beyond the numbers, holistic strategies to slash your stroke risk. Understanding these silent pulse warnings, AFib and high pulse pressure, is the first step, but action is key. The good news is that many of the lifestyle changes that help manage traditional high blood pressure are also incredibly effective at reducing your risk for AFib, improving arterial stiffness, and thus pulse pressure, and generally preventing stroke. It's about taking a holistic approach to your cardiovascular health. First and foremost, prioritize a heart-healthy diet. Focus on consuming plenty of fruits, vegetables, and whole grains. Limit processed foods, unhealthy fats, and excessive sodium, which can contribute to high blood pressure and arterial stiffness. Adopting a Mediterranean-style diet, rich in olive oil, nuts, seeds, and lean proteins, has been shown to support cardiovascular health and can aid in weight loss and blood sugar control, all of which benefit your heart. Small, consistent dietary changes can yield significant long-term benefits for your pulse and overall well-being. Regular physical activity is non-negotiable for stroke prevention. Aim for at least 150 minutes of moderate-intensity aerobic exercise, like brisk walking, swimming, or cycling each week. Exercise helps you maintain a healthy weight, strengthens your heart muscle, and improves blood vessel elasticity, directly impacting your pulse pressure and reducing AFib risk. Even if you have AFib, regular exercise can reduce symptoms and improve your quality of life. Start small and gradually increase your activity level, always consulting your doctor before beginning a new exercise regimen. Maintaining a healthy weight is another cornerstone of stroke prevention. Carrying extra pounds significantly increases your risk of high blood pressure, heart problems, diabetes, and AFib. If you're overweight or obese, even a modest weight reduction, e.g., 10%, can lead to significant improvements in your blood pressure, pulse pressure, and AFib burden. Combine a healthy diet with regular exercise to achieve and maintain a weight that supports your heart health. Quitting smoking is one of the single most impactful actions you can take to slash your stroke risk. Research definitively links smoking to numerous diseases, including stroke, heart disease, and lung cancer. Smoking damages blood vessels, increases blood clotting, and makes arteries stiffer, all of which exacerbate AFib and contribute to high pulse pressure. If you smoke, seek support to quit. Your heart and brain will thank you. Moderating alcohol intake is also crucial. Excessive alcohol consumption is a known risk factor for atrial fibrillation and can contribute to high blood pressure. While some studies suggest a small amount of red wine might have benefits, for AFib specifically, evidence suggests less is more, and even abstaining can reduce AFib episodes. Discuss safe alcohol limits with your doctor, especially if you have existing heart conditions. Don't underestimate the power of stress management and quality sleep. Chronic stress can negatively impact your blood pressure and heart rhythm. Incorporate stress-reducing activities into your daily routine, such as yoga, meditation, deep breathing exercises, or simply spending time on hobbies you enjoy. Equally important is getting 7 to 9 hours of quality sleep each night. Poor sleep, especially sleep disorders like sleep apnea, is linked to higher blood pressure, AFib, and increased stroke risk. Prioritize your sleep hygiene for a healthier heart and mind. Finally, proactive management of other underlying health conditions is paramount. If you have diabetes, high cholesterol, or existing high blood pressure, work closely with your doctor to keep these conditions well controlled through medication and lifestyle. These conditions are strong risk factors for both AFib and stroke. Regular checkups with your healthcare provider are essential to monitor your overall cardiovascular health, discuss any concerns, and ensure you're on the right treatment path. They can help interpret your silent pulse readings and guide you towards optimal stroke prevention. The silent stroke connection. What happens when warnings are missed? When these silent pulse warnings, AFib and elevated pulse pressure, go undetected and unmanaged, the consequences can be devastating. They contribute directly to a terrifying phenomenon known as a silent stroke. Unlike the dramatic strokes we often see in movies, a silent stroke occurs without obvious symptoms, often leaving permanent brain damage in its wake. A silent stroke happens when blood flow to a small area of the brain is blocked, depriving it of oxygen and causing brain cells to die. Because the affected area is typically small or in a less critical region of the brain, there are no immediate noticeable signs like slurred speech or facial drooping. Many people are completely unaware they've had one until it's incidentally discovered during a brain scan, MRI or CT, performed for an unrelated reason. The insidious danger of silent strokes lies in their cumulative effect. Each silent stroke causes permanent damage to brain tissue, and while one might not have immediate dramatic symptoms, multiple silent strokes over time can lead to serious and irreversible consequences. These include progressive cognitive decline, memory loss, difficulty with concentration, problems with balance and coordination, and even dementia. These subtle changes often get mistaken for normal aging, further delaying diagnosis and intervention. Perhaps most critically, experiencing silent strokes significantly increases your risk of having a future, more severe, major stroke. These undetected brain injuries weaken your brain and make it more vulnerable to a larger, more debilitating event. This is why understanding and addressing the underlying causes, like undiagnosed AFib and high pulse pressure, is not just about preventing silent damage, but about safeguarding yourself against a potentially life-altering major stroke. Don't let these silent warnings turn into a life-changing event. Your vigilance now can prevent years of cognitive decline later. Subscribe. Which advice will you start applying today?